So first we are going to start with Mr. Foreman's chest. First inspecting for AP diameter, which is twice as much in the front as there is in the back, which Mr. Foreman has for a normal healthy adult. So now we're going to move to assessing his rate, rhythm, and depth of his respirations. Mr. Foreman is breathing at a rate of 16 breaths per minute, which falls into the norm of 12 to 20 breaths per minute. He is breathing at a normal rhythm. It's not exaggerated, it's not too slow, it's not irregular. He's also breathing with a normal depth. It's not too exaggerated, once again, and it's not too shallow. So there are no concerns there. So now we're going to auscultate the lung lobes. So I'm going to have him face the camera. So when auscultating the lung lobes, we want to hear, normal sounds would include vesicular, which is what you'll normally hear. There's also bronchovesicular and bronchial sounds as well. So when we are auscultating the lungs, we want to listen to all 5 lungs. There will be 3 on the right side and 2 on the left side. We want to use our diaphragm. So we want to make sure we're in the intercostal spaces when listening to the lung lobes, just to ensure we're not listening over bone. So I'm going to go ahead and do that now. Okay. Right, and we want to make sure we move in a ladder, moving over. So then I'm going to have him turn to the side so we can listen to this 3rd lobe on the right side. We want to make sure we're in the 5th intercostal space, mid-axillary line, which is roughly where it should be. Okay. Great. I'm going to have you turn to your other side of the camera. We're going to do the same as well. Okay, great. So have your back to the camera for me.
Okay.
So now we're going to do the posterior side. We just completed the anterior side. We want to be mindful of the scapulas as well as his spine because we're also listening around those. So we want to make sure we palpate. So once again with the diaphragm, just feeling and moving in that ladder pattern again. Moving down, making sure I'm not over that scapula. Great. And great. Okay, you turn back around for me. So I listened to all 5 lungs. We heard vesicular sounds all around, like I described earlier. So now we are going to move to the heart. So first I'm going to start with the PMI, also known as the point of maximum impulse. This is where we're going to find the most accurate pulse for our patient. Sometimes it's used with medication administration. We use it in our neonates especially, but for Mr. Foreman, we're going to go ahead and perform that. So we would, find the PMI, 5th intercostal space, left sternal border, just below the nipple line. And we would, once again, auscultate this, or we can palpate it as well. I'm going to auscultate. And we would listen, so we would find it and listen for 1 full minute. And after listening for 1 full minute, Mr. Foreman is at 70 beats per minute, which falls in between 60 to 100 beats per minute, which is the norm for a healthy adult. So after doing that, I want to auscultate the valves. So we would do our first pass through listening to all 5 valves with our diaphragm, our second pass with our bell, and we do that because we want to listen for higher pitch noises and lower pitch noises, higher being diaphragm and lower being the bell. So I'm going to go ahead and do that. So first with my diaphragm, we will find the aortic, 2nd intercostal space, right sternal border. Make sure we're palpating and we're in the right area. Okay. Now moving over to the pulmonic, 2nd intercostal space, left sternal border. I'd like to also mention that the rest of these valves will be left sternal border. Okay, moving down to the 3rd intercostal space, we will find Erb's point. And then 4th will be mitral. And then 5th, where we found the PMI, would be our mitral valve. And I may have mistaken. I said the 4th was the tricuspid, 4th intercostal space. And then the 5th intercostal space is mitral. Okay, and then I would flip around to my bell, going through that same pattern and locations that I just previously said. Pulmonic, Erb's point, tricuspid, and mitral. Okay, great. So after auscultating with both my diaphragm and bell with Mr. Foreman, we note that he had that normal lub-dub, which is what we want to hear. So we heard S2 louder in the aortic and pulmonic. Erb's point was equal with S2 and S1. And then tricuspid and mitral was equal with S1. Excuse me, it's louder with S1. So he had the normal S2, S1, and that's great. We didn't hear any S3 or S4 extra heart sounds to indicate a gallop. We didn't hear any murmurs or anything like that, so everything was healthy. So I'd like to move to his lower extremities. So I'm actually going to move the camera down just so you can see better. Okay. Great. So moving down to his lower extremities, first I'm just going to palpate, making sure Mr. Foreman can feel me touching him all the way down. Could you feel that?
Yes.
Great. Okay, so now we're going to do some range of motion exercises. So Mr. Foreman, if you will just follow me and let me know if you have any pain, discomfort, and I'm also going to be making sure that he can move each extremity well. Okay, you ready?
Yes.
So move this leg out. Great. Move this one out. Great. Move a little to the side. Okay, so just stick your right leg out, your left leg. Great. So I'm going to have you sit down for just a minute. Okay. Now extend your knee. Extend your other knee. Now, if you'll rotate your ankle one at a time, the other way. We're going to do the other one. Just follow me. You're good. Was there any pain or discomfort with any of those activities?
No.
Okay, great. So now I'm going to test lower extremity strength. So I'm going to have you put your hands here and push on the gas pedal. Okay, great. Now pull up on the gas pedal. Great. Okay. So Mr. Foreman's sensation is intact, his strength is intact, it's equal on both sides. So now I'm going to test capillary refill. I do so, if you can see it, by pushing on the toenail beds. Doing at least 2 would be great. And bilaterally, they're both less than 2 seconds, which is great. I would also want to palpate the dorsalis pedis pulses, which tends to be right between the first 2 toes, +2 equal bilaterally. And then I want to also do the popliteal, which is just behind the ankles right here, +2 equal bilaterally. That's actually not the popliteal, that is the posterior tibia, if I said that. So that is all I have for Mr. Foreman today. Everything looked great, and that's all I have.